In 2004,
there was a need to find a solution to a problem
affecting very many LGBT persons in Uganda.
12 years later today, against all odds,
SMUG still strives to help more LGBTI persons in Uganda get access to HIV and other health services.
There is a very big problem in terms of information on HIV and AIDS, and also on general health for LGBT persons.
When you go into a health facility, you find that you cannot disclose completely. And full disclosure means full treatment.
A lot of discrimination in the health sector, whereby programming is, sort of separated. Like if LGBTI persons are to access health, there's a particular place they go to, not access to the general public.
That creates a barrier in LGBTI persons accessing health, and also it creates again a problem of we also as LGBTI persons to self-stigmatize.
Secondly, we have the adherence problem, whereby that is boosted by the lack of knowledge.
You find that because the government and all the policies we have in the country do not address anything that has to do with LGBT persons or men who have sex with men.
Because if you look at the kind of advertisement or information sharing, it does not involve the LGBTI community, which means that this special or this key population does not have access to information. And as we all know that information is power.
Most people don't know about information about lubricants and condoms.
Again, the legislation limits how much information or any information that we put out there.
I did not even know there were organizations in place to provide health services. Eventually, I found out about Farouk, Freedom and Roam Uganda, and it was from there that I got to know other information about health centers like MAPI and IBU clinic.
If you look at the Crane survey, talks about the high prevalence among men who have sex with men, which is at 13%, which again, if you look at the national HIV prevalence, it's almost times 2.
So if people have, for instance, websites or publications, there has to be specific information that one can access for them to get full attention.
Sexual reproductive health and rights is very, very important, because we're not only talking about HIV, but we also talk about other issues.
It's important to have that information out there so that people know, and they know where to get treatment from, where they won't be discriminated or stigmatized on the basis of their sexual orientation or gender identity.
So giving us the knowledge that the services actually do exist will boost the momentum for people to access the health. And then accessibility, it should be a general. There shouldn't be separate projects that these are for key populations or these are for particular persons. The accessibility should be for all.
If people have all this information, then we shall have an empowered community and a safer community.
If we are able to reach that, we need to be able to reach out to every vulnerable group.